everyone, welcome back to another cue card discussion. I'm 𝗥𝗶𝗵𝗆 and today I'm here with 𝗁𝗏𝗄𝗁. So we are back with another cue card, and today we are going to look into a case note where a patient has irregular heart rhythm, right?
Yes.
And the patient has questions about what is wrong with him, and we have to provide information about that. Yeah. So I'll be the part of the nurse, and Grace will be handling the part of the patient. So without much delay, let's get started with it. All
Okay.
right? Okay.
Your time starts now.
Your cooperation is well appreciated, Mr. David. I have just finished examining you. So on the basis of my examination, I could see that you are having fast fluttering heartbeat, which indicates a condition called atrial fibrillation. So do you have any idea about it?
No, I have no idea about it. So what do you mean by that? Am I going to die?
Well, I understand that you have a lot of questions and you're really worried about your condition, but please be relaxed. You're in safer hands right now. We are a well-reputed hospital with a lot of experience, so do not worry, okay? I'll explain each and everything in detail to you, okay? So to begin with, I'll explain what is this condition, all right? So this condition is where you experience rapid heart rate, often causes poor blood flow. Okay, and I'm sorry to say that it can cause potentially life-threatening complications such as stroke, heart attack in severe cases as well. I know it sounds really worrying for you and you're so concerned about it too, but this is just a lifestyle condition, okay? So if you make some changes in that, you can control it as well. So you do not have to be so concerned about it. It is under control at the moment. So do you have any concerns that is bothering you?
Yes, right now I understand that it is a serious condition and I need to do something very urgent about it. So can you please tell me what can I do to save my life?
Absolutely, okay. So if you have a determination to make some lifestyle changes, then this is going to be an easy task for both of us, okay? So I'll explain each and everything. So now I need to tell you the impact and consequences of treating this condition properly, because if this is neglected or if you're not giving proper treatment for your condition, it can cause many serious complications such as the heart attack and stroke that I mentioned earlier. So all you need to do is proper monitoring of your condition. You need a proper routine of your life. I hope that is easy for you, right?
Yes, I will try that.
Yes. So what do you do for a living?
I'm a driver.
All right. Okay. So do you get enough time to exercise or things like that?
No, actually I'm a truck driver. My job involves a long distance driving, so it is very hard for me to follow any kind of routine or pattern of exercises.
And what about your eating habits? Do you get time to eat from home or do you
Oh, never. I always eat from outside because my journey is for a long period. So it is very difficult for me to take homely food wherever I go. So I depend on outside food and takeaways.
All right. I perfectly understand that, because of your work nature, you won't get much time to engage in physical exertion, physical activities, or eat good healthy food as well. But given your condition, it is important that we try to make some changes, okay? To begin with, it is important that you try to take the proper treatment, okay? Along with that, lifestyle changes can manage your condition, okay? So although this is going to be a long-term condition for you, as I mentioned, proper management will lower the risks involved in it, all right? So what you need to do is, we will prescribe the medication which will help to normalize or stabilize your heart rhythm. So make sure that you take the medicines at the right time at the right dosage.
Sure, I can do that.
Well, that's good. And it is important to maintain your heart health. For that, it is important that you engage in physical exercises. If you're not finding enough time every day, at least 20 to 30 minutes will be fine. Initially, it might be a little difficult to make some changes in your daily routine, but gradually it will be easier for you, okay? So initial days will be a little hectic, but don't worry, do not give up. Just try to engage in some physical exertion for fewer minutes initially, and gradually you can increase the time, all right? Then please make sure that you monitor your cardiac status. It is very important because we need to know where your progress is. So it is very important that you regularly come for your checkups. Will that be okay with you?
Yes, that is fine with me.
All right. So do you have any other concerns?
No.
Well, in that case, just to go over what we have discussed today, you were admitted to the hospital with irregular heart rhythm, and based on our examination, we found that you have a rapid heartbeat, that is a fluttering heartbeat. So I have explained the causes of it, as well as I've taken you through the treatment options available as well. And I've also explained about the importance of taking the proper treatment and making some lifestyle management. So is there anything else you would like to discuss with me?
Nothing more.
Well, in that case, would you mind to wait to see the doctor for a further detailed checkup?
I can wait.
That will be fine. It won't take much longer. Please wait for another 10 minutes time, okay? All right then. So please wait here. I'll call you when it's your turn, all right?
Thank you.
Thank you for your time.
Well, that's the end of the role play, and I hope it was a very good and informative role play for you all, and all the points were explained in detail. And if you wish to know more about the explanation of each points, you can well check it in the feedback session, where we will be discussing in detail regarding the explanation of each and every point.
So we'll start with the feedback session, where we can see how easily you can create statements, and we'll come back with another cue card where we'll discuss more important and interesting topics. So we'll see you guys next time. Until then, take care. Bye-bye. Hello, hi everyone, welcome to the feedback session. So you just watched a video where we are talking to a patient who was brought to the emergency department with irregular heart rhythm, and the patient was diagnosed with atrial fibrillation. So we just watched how the scenario was and what were the tasks as well. So in this particular session, what we are going to do is we are going to look into each task one by one and see how easily you can create statements. Okay, so let's get started. So this is our cue card. So you can see the setting given as an emergency department, and let's read the background information together. So you are talking to a 42-year-old presented with irregular heart rhythm. On examination, it was noted that the patient has atrial fibrillation. So from this particular information, we have to identify whether it is a known case or an unknown case. Okay, so in this particular case note, it is mentioned that the patient underwent the examination. Okay, so you can see it here, which means the examination was done, so the patient is a known case, so this has to be treated like a known case. So that is the task analysis that we have here. You have to frame the opening statement using the setting, background information, and task 1, as I always tell you. So it is a known case, so that you have to check the name of the patient during 3 minutes preparation time. So in this case, let's call the patient Mr. Michael. So let's have a look at our task number 1. Confirm the diagnosis: atrial fibrillation, fast fluttering heartbeat. Okay, so basically our role here is to confirm. Okay, so what do we have to confirm? We have to confirm the diagnosis. That is what we have to do here. Okay, so let's see how we can start our opening. So basically in this particular scenario, I feel like we can have 2 different types of introduction, where you are self-introducing yourself and then telling the patient that you are there with the test result or the examination findings, or you can start by saying that the patient has finished the we are telling the patient that we have finished the examination, and then you can directly start by explaining the findings. So there is a slight difference in these 2 types of opening statements. So I have prepared 2 different introductions here. So let's have a look through it. So the first one is where you are introducing yourself, and then you are telling the patient that yes, I'm here with the examination findings and I'm going to explain that to you. So let's see how that will work. Okay, so this is how it goes. Good morning, my name is Richa. I'm one of the registered nurses working here. I will be taking care of you. I'm here to discuss the findings of your examination. It is noted that the irregular heart rhythm you have been experiencing indicates atrial fibrillation. Have you heard about atrial fibrillation? So this is how you can start this particular cue card or this conversation, by explaining your details or by introducing yourself. Now let's see a different introduction which is also applicable in this particular scenario. So you can start by saying, thank you for your patience, Mr. David. You have been examined thoroughly, and based on your symptoms, that is fast and fluttering heartbeat, it is confirmed that you have something known as atrial fibrillation. Have you heard about atrial fibrillation? So this is how you can start this particular conversation in a different way too. So both of these are kind of like applicable in this situation. I feel like both can be fine. So if you want to introduce your name and say everything like like you had examined the patient and you're there with the examination, you can do that too. Now if you ask me why both these are correct, is because if you look at the background information or the cue card, it is mentioned that on examination it was noted. So it is not mentioned that you have examined the patient. Okay, so it is just mentioned on examination, so it might be a team or it might be someone else. So you cannot say that, you know, I have just finished your examination. Instead of that, what you can do is you can say something like this. Okay, so I'm here to discuss the findings of your examination, like this. Or you can say, like, you know, you have been examined thoroughly and based on your symptoms. So we are not saying that I have examined you here, because you know, in our cue card it is not mentioned that you have examined the patient. So both of these will be right in this particular aspect. So this is the opening statement, and I hope it is clear for you guys. Now let's look into task number 2. Explain the condition and its seriousness. Rapid heart rate often causes poor blood flow, potentially life-threatening complications, stroke, heart attack, etc. Okay, so here we are going to explain the condition and its seriousness. Okay, so if you relate to the previous conversation, which is this one, have you heard about atrial fibrillation? The patient would say, no, I haven't. What is it? So you're going to continue the conversation here. Don't worry, I'll explain everything in detail to you. So that is an assurance that you're telling the patient, because you're going to provide information to the patient. So you're going to tell the patient, don't worry, I'm here, I'll explain everything in detail to you. So now let's see how you can explain it. It is an irregular and often rapid heart rhythm that can lead to blood clots in heart due to poor blood flow. So this sentence has been created from here. Rapid heart rate often causes poor blood flow. So this is the point which was elaborated here. Now if you look at the sentence which I have created here, you can see almost all these points have been mentioned here. So rapid heart rate often, so I have mentioned irregular and often rapid heart rhythm. So rate has been changed to rhythm, and it causes poor blood flow has been changed to that can lead to blood clots in heart due to poor blood flow. So that is how you can elaborate that point. Now let's look at the next one. Potentially life-threatening complications, stroke, heart attack, etc. So that point also has to be mentioned here. So let's see how we can explain that. Therefore, it increases the risk of stroke, heart attack, and other heart-related complications. That is a very detailed way of explaining that point. We are connecting it because in the first statement we have mentioned that because of this irregular heart rhythm, there is a possibility of poor blood flow. Okay, so that poor blood flow increases the risk of stroke, heart failure, and other heart-related complications. So that is how we can connect these information to form a very beautiful statement. So we have finished explaining task number 2, but that is not it. Whenever you give information like this which is worrying to the patient or which might be upsetting the patient, always keep in mind that you use an empathy statement or something like this, like a reassurance statement, to make the patient feel okay. I know it sounds worrying to you. Please be relaxed. It is not usually life-threatening or considered serious in people who are otherwise healthy. So we are telling the patient that I know this is sounding a little complicated and you're worried that this is going to be life-threatening, but it's not usually life-threatening or considered serious in people who are otherwise healthy. Okay, so you are making the patient feel a little okay after you give out this information. So always make sure that you give some information like this whenever you explain a diagnosis or you tell the patient that the patient has been diagnosed with some problem. Okay, so that is how we can do that. And then you have to check with the patient whether the patient has any questions to ask. This is also important because we need to explore the concerns or expectations or feelings of the patient. It comes under our assessment criteria too. So make sure that you do that. It's always good to check with the patient whether the patient has anything to ask or whether the patient has anything to contribute into the conversation too. So this is how we can do task number 2. Let's move on to task number 3. So task number 3 is here. Tactfully explain the impact and consequences. Untreated increases risk of stroke, heart attack. Treatments and lifestyle changes can manage the risks. So we're trying to tell the patient that it is important that we treat this particular thing, otherwise there might be some problems related to it. So let's see how we can break this down and create simple sentences. So the first part is we are telling Mr. David, Mr. David, I would like to bring it to your attention that the proven effective way to handle this situation is to take proper treatment and modify your lifestyle. So we are telling the patient how we can manage it and what is the proven effective way of doing it too. So if you check here, I have used really good statements. You can see that here. I would like to bring it to your attention. Okay. The proven effective way to handle this situation. Okay, so these are two different usages that you can use, or different way of sentence construction that you can try to include in your role play so that your sentence construction would look a little better. So you can say like this: I would like to, instead of always saying I would like to tell you that, I would like to discuss with you that, instead of that you can say I would like to bring it to your attention that the proven effective way to handle the situation. So instead of saying the best way to manage the situation, you can try to use that. The proven effective way to handle the situation is to take proper treatment and modify your lifestyle. So that has been explained in this particular task. You can see here. Okay, and then we are going to explain this point: untreated increases risk of stroke, heart attack, other problems. Okay, so we're going to explain that here. If it is neglected, as mentioned earlier, it might increase the risk of stroke or heart related complications. Okay, so it is simply mentioned here: increases risk of stroke, heart attack. So I'm saying if it is neglected. Untreated, I changed it to neglected. So if it is neglected, as I mentioned earlier, because this particular point, the risk involved was discussed in the previous task, so you can say, as I mentioned earlier, it might increase the risk of stroke or heart related complication. And then you're continuing by telling the patient that I have your best interest at heart, which means that I do care for you. That is why I strongly suggest you to consult the doctor to discuss the treatment regime and make certain healthy changes in your lifestyle. So this particular statement is something which I have put in extra so that you will relate more with the patient there. Then we are telling the patient, so the risks involved can be managed. So this point, treatments and lifestyle changes can manage the risk. This is the point which was elaborated here. That is why I strongly suggest you to consult the doctor to discuss the treatment regime and make certain healthy changes in your lifestyle so the risks involved can be managed. So you can see how it was elaborated there. Then once you have given the suggestion, always check with the patient. I hope you understand the significance of what I'm saying. So instead of asking the patient, are you following me? Do you understand? Is that clear for you? So to avoid the repetition there, you can use some statements like this too. Now, that is the entire explanation of task number 3. Let's look into task number 4. Encourage the patient. Long-term condition, proper management lowers the risks. Medicines, maintaining heart health, regular exercise, cardiac monitoring. Yes, so we are going to encourage the patient. Let's see how we can do that. So when you ask Mr. David, I hope you understand the significance of what I'm saying, Mr. David is obviously going to say, it is really worrying me to know that I have a possibility of having heart attack. Is it's really panicking, so I am super annoyed or super worried. Okay, so you can tell something like this: yes, Mr. David, I understand the whole situation is intimidating for you. Okay, this is a really good statement that you can use. You're telling Mr. David, yeah, I totally get it. I understand the whole situation might be frightening for you. Don't worry, I assure you that you are in safe hands. That is a really good statement that you can use to encourage the patient. And now we are going to explain this point. Long-term condition, but proper management lowers the risks. Take medications on time, maintaining heart health, regular exercise, cardiac monitoring. So we are going to elaborate that point here. Although it is a long-term condition, say it is mentioned long-term condition here, so I'm going to use this phrase or this connector here and say, although it is a long-term condition, proper management helps to lower the risks. Okay, so if you look here, this is the statement which was given in the task: long-term condition, proper management lowers the risks. So I'm saying, yeah, I understand it's a long-term condition, but if you properly manage it, then it will lower the risk. So that's the point we are going to elaborate. So this is how you can frame a good statement here. Although it is a long-term condition, proper management helps to lower the risks. Okay, so the next point, medicines. all you need to do is to take the medicines regularly on time. Okay, so one point mentioned here is medicine. So we are telling the patient, all you need to do is take the medications or medicines regularly on time. Next point is maintaining our heart health. You can say maintaining heart health is very important. So we are connecting this regular exercise to that. Therefore, exercise regularly to stay healthy. Then we have one more point, cardiac monitoring. On top of all, regular cardiac monitoring can also be beneficial. See, I've explained each points here and given extra explanations to that particular point individually so that your sentence will look really good. So if you ask me whether you have to explain all these bullet points mentioned in the bracket, I would say it's not mandatory, okay, because these bullet points which are given in your cue card is for your understanding and it is a hint provided for you to create sentences in an easy way. So if you can learn, or if you learn to connect these bullet points properly and create really beautiful sentences, then it will be really effective and your entire explanation will look really fantastic. So you can try to do that. If you don't want, you can just pick the main points and then connect your own statements and then associate it with some reassurance statements and everything to make it look a little bigger. But this would be also a very effective way to do that, because if you just follow each points and elaborate it a little bit, not giving, I didn't mean to say that you have to give really long explanations for each point, but if you can pick up small explanations for each point, then it will look really better. So you can see how it was explained here. And once you have given the suggestions, you're checking with the patient, will you be able to follow these instructions, okay? So you can use any short questions there. Our point is to check with the patient whether the patient is okay with it. So you can say that, or you can ask that question. So that is how you can complete task number 4. Now task number 5. Suggest the patient to wait to see the doctor for a detailed checkup and further treatment. So, relating to the previous conversation, will you be able to follow these instructions? So Mr. David is saying, yeah, I will follow the instructions. So you're saying, well, I'm glad to hear that. Okay, so instead of saying, well, I'm glad to hear that, you can use different statements like, well, I'm happy to hear that, or I'm delighted to hear that, well, that's really good, or that's really good to know. There are different usages that you can use here. And then you're telling the patient, as I have discussed earlier, because we told the patient about meeting the doctor and following the treatment regime as said by the doctor in a previous task. So you're saying, as I have discussed earlier. Please wait to see the doctor for a detailed checkup. So see, just mentioned here, wait to see the doctor for a detailed checkup. So you can use the same pattern here too. Please wait to see the doctor for a detailed checkup. He will be here soon. Don't worry, he will provide more information regarding how to manage your condition. So this is the point for the treatment. So we have just explained it in a little more elaborated way. Don't worry, he will provide more information regarding how to manage your condition. Then we are asking the patient one last question. Do you have anything else to ask me? This is important. As I told you earlier, whenever you ask this question, our main idea is to explore whether the patient has any further concerns, and it comes under assessment criteria too. So always keep in mind to ask this question. Then the patient is saying, no, there is nothing else. Then you're telling the patient, all right, then please take rest. I'll be back with the doctor. Okay, so the patient is like, okay, I'll wait here. Then you're saying thank you and you're leaving. So that's the end of this discussion here. So I hope it was clear for you guys. Alright, so we just saw how easily we can create statements using the keywords which is given in the cue card, and I hope it was helpful for you guys. If yes, let us know in the comment section and also share it with your friends as well. So I'll see you guys in the next video. Until then, take care. Bye-bye.
IILT, it's my cup of tea.